Many times patients come to us saying that doctor, I have problem with wheat. Hello everyone, I am Dr. Pankaj Singh, Senior Consultant Gastropedia Clinic, Noida. Today I will be discussing about two major medical problems which can be related to wheat. First is wheat allergy and second is celiac disease. So wheat allergy is a sort of allergic immune mediated reaction to wheat and it happens over minutes to hours after exposure to wheat. But celiac disease is a autoimmune disease in which there is autoimmune antibody formation against gliadin. Gliadin is a component of gluten and gluten is the protein which is found in wheat, rye and barley. So it is a autoimmune disease and it evolves over weeks to months to years and it does not happen within minutes. The basic symptoms that we have in patients with wheat allergy is itching, rashes, breathing difficulty, wheezing, there can be hives and there can be sudden anaphylactic reaction which can be sometimes a medical emergency. And celiac disease, since it is a long-standing problem, the symptoms are also in a similar way, can be chronic diarrhea, there can be malabsorption because of the damage to the intestinal walls leading to a state of macronutrient deficiency, iron deficiency, calcium deficiency, there can be failure to growth and fatigability. These are the common symptoms that a person with celiac disease they do have. And one major basic difference between both the conditions is that in celiac disease will have changes in the intestinal lining or intestinal wall, like there will be villus atrophy of the villi, and it is a syndrome complex. Celiac disease is a syndrome complex, but wheat allergy there will not be any damage to the intestinal lining or the intestinal wall. It is a sudden reaction to wheat. And in between wheat allergy and celiac disease there is another terminology which is known as gluten sensitivity. Gluten sensitivity is that person will be tolerant to gluten but there will not be any sort of allergic reaction. Now regarding diagnosis, wheat allergy is diagnosed with some specific skin prick test and with some wheat specific antigens are used. There are also certain wheat specific IgE blood test and also there will also be a definite history of wheat intake prior to the episode. And diagnosis of celiac disease is also very simple. There will be very categorical and typical history related to celiac disease, and from the history and the clinical examination we will certainly have some doubt regarding the possibility of celiac disease. And when we have these possibilities, we do a blood test which is known as anti-TTG IgA level, and if it comes out to be positive, then for confirmation we also do an endoscopic test where we take some biopsy specimen from second part of the duodenum and we check under the microscope whether the villus atrophy is there. If there is severe villus atrophy with anti-TTG positive, it is a definite case of Crohn's disease. And this is how we diagnose. Regarding treatment, wheat allergy, we have to avoid wheat at any cost because the person may have further episodes of wheat allergy. Also, I would like to say that wheat allergy is a very rare thing to happen. It is a sort of allergic reaction, so you have to avoid wheat. Celiac disease is a common problem which is seen very commonly, and in this condition also we need to restrict gluten containing food like wheat, rye and barley. And you need to remember that even a trace amount of gluten in the food can trigger the symptom or further worsen the symptom. So these are the two conditions where wheat is the culprit, but we also need to understand that what are the symptoms related to wheat allergy, what are the symptoms related to celiac disease, to have better understanding about the disease and better awareness of the condition. Thank you so much.